So in this question, we have a 20-year-old male that comes in with hearing loss, and exam shows no sensory or motor loss. Rene and Weber tests are performed, and a cholesteatoma is high on the differential. What would the results of the two tests be? So we have the abnormal Rene test of the right ear. Bone is greater than air conduction, and Weber test localizing at the left ear for A. And then essentially the same thing for B, except it's at the right ear. C is normal Rene and Weber test. And finally, normal Rene test of the right ear and Weber test localizing at the left ear. So I'll let you answer the question, and then I will explain in 5 seconds. Okay, and so the answer is going to be B. So I'm just going to explain how you do these tests. So the first one is going to be the Rene test. So first of all, you take the tuning fork and put it on the side of the ear where the mastoids are. And so once you put it there, after you ring it, the patient's going to be able to hear it. And once they stop hearing it, you will put it next to their ear, and then you'll ask them when they stop hearing that. So in this case, what happens is, since you have a cholesteatoma, which is essentially an overgrowth of squamous cells in the middle ear, and then that can eventually start taking away some of the ossicles and create a conductive hearing loss. What happens is it's going to prevent sound waves from coming into the ear, right? And so if you're going through bone's actually going to bypass the problem, and then you're going to be able to hear it. But in terms of air's a problem because it's being blocked by this essentially traffic jam right here. And so that's why in this case, the answer is B, because in this case, it's saying that bone is greater than air conduction. So what happens is when you put the tuning fork to their mastoid bone, it's going to conduct and they can hear it. And then when you after they stop hearing it, you're going to put it up to their ear and they actually can't hear it anymore. And so that tells you that bone is better than air. And so that, once again, points you in the direction that it's a conductive hearing loss. The second test is the Weber test. So this one, you put the tuning fork after you ring it on the top of their head. And so it's going to localize to their right ear, right? So left, right ear. So it's going to localize here because, once again, it's going to conduct better for patients on the side that's affected, right? So the sound waves are being distributed through the bone, and since on this side, air or sound waves through the air are not being transmitted, it's almost like this is muffling the outside noise. It's kind of like a noise cancellation, and so you're actually going to hear the noise better on the side that's obstructed, if that makes sense. So it's like you're wearing an AirPod right here, and it's blocking out outside air. So you're actually going to hear this conduction better, and you're going to hear it localized on the obstructed side, on the right side in this case. So that's a basic explanation of how these two tuning fork tests work to help determine what type of hearing loss the patient has, which is sensory neural versus conductive. In this case, it would be conductive due to the type of blockage they have. So the first part is knowing this condition causes you to have a conductive hearing loss, and then knowing the results of a conductive hearing loss test with both of these tests. So I hope that helped, and thanks for watching.